Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm in studio at 888-630-9625. That's 888-630-WMAL. That's how you find me here. And how you find me when we're not on the air is you go to rosellecare.com, or you can call us at 703-698-7117. But, right now we're broadcasting to you from 105.9 FM and AM 630 WMAL. Love to talk to you today on any subject you have in mind. Perhaps you've had a problem, you've tried, you've applied, and come up with the same old, not a whole lot that works. Well, here's an opportunity. Let's do it together. Let's kind of open the door and see what we can do and fix you without drugs, without surgery. That's why I'm here, giving you the most up-to-date information that we possibly can. I want you to understand something, that your health is in your control. You have the capacity to move yourself forward. You have the capacity to stay where you are or get worse. That's a lousy situation, particularly if you've been suffering for a long time. See, I have this belief system, and this belief system simply is this, that as long as you're breathing, you can get better. But you have to have the steps to do that, and that's why we do Dr. Tom Roselle live every Sunday at 12 noon, is to give you those steps, and that's why we continue the process after many, many years. But today, we're going to talk about things that are in the news. We're going to talk about little tidbits, if you will, that can make huge differences in your life. But before we get there, I want to remind you of a couple things. You have about 5 more days to call thermographycenters.com, and Thermography Centers is offering in the month of August only, at any of their centers, they're offering a 20% discount on any thermographic scan, no matter what it is. But you have to do it this month. You have this week, pick up the phone, give them a call, and you can get it done. Now, if you call them this week and you can't get there to next week, but you schedule the appointment and you pay for it this week, they will accept that. Not an issue. So you have, even though that you can't wiggle it in this week, if you call them this week and you pay for it, they'll give you the 20% and you can have it at another date. So give Thermography Centers a call. Go online, thermographycenters.com, and you'll be able to find them and tell them that Dr. Tom said so, and they will honor that. 888-630-9625. That's 888-630-WMAL. Let's get into a couple things that I think that are interesting in the news for you today, because there's so much out there, and there's so little time to really explain it all to you. People ask me from day to day different things that come up, and I said, well, I think I read that, but the truth it is there's so much out there. There was one on pomegranate juice. Everybody tries to get on the bandwagon, then they squeeze the juice, and they squeeze the berries, and of all kinds of different things. But pomegranate juice may hold the key to a lot of different things, and that's what the guidelines say. But you know what? Here's the deal. Pomegranate juice has been around for a long time, and it's part of that crazy Mediterranean diet. I've had pomegranates on my plate at holidays and, other than holidays, regularly since I was a kid. But there was an article that was published at the Sheffield Hallam University in South Yorkshire, UK, and they recently concluded that pomegranate juice may improve cardiovascular risk because of the presence of, guess what, antioxidant polyphenols. Well, wahoo, we've known that for a long time. We know that polyphenols, when they're part of your diet, no matter what form, they do a really nice job. But they did the study, and the study was a randomized, placebo-controlled study with participants given about 330 milliliters of pomegranate juice per day and a control drink for 4 weeks. And then what they did is they measured the pulse waves of the heart and the blood pressure, and then the the plasma antioxidant statuses, and then they compared it to the baseline. Well, here's the deal. There was no effect on the pulse as far as the pulse wave. The subjects taking the pomegranate juice showed significant fall in systolic pressure. That's the upper pressure. You have systolic and you have diastolic. And, the pressure within the artery itself was dropped. The scientists, got their heads unscrewed a little bit, and they said, whoa, we got something going here. And if you want to look the study up, it was published in Plant Foods Human Nutrition, 2012, May 31st, so just this last spring. Interesting piece of information, because it really links into so many other things. Does pomegranate juice provide a piece of the overall puzzle? Absolutely, positively. But are there other things that provide polyphenols as well? You betcha. And you got to do your homework and start. We could go on the rest of the programs, but there's so many other things I want to talk to you about today. And if we stick on that subject, we're not going to get anywhere. So let's talk about some other things that are really important. Substance called coenzyme Q10, and it was used recently in a research study for Huntington's disease, Huntington's chorea. And it's this is one of those things that doesn't show up, thank God, a lot. But CoQ10, due to support of what we call the mitochondria and its oxidant effect, has been investigated as a possible agent to treating Huntington's disease. The research evaluated 20 Huntington's disease patients and 8 control patients, and they given coenzyme Q10 in the clinical trials. Blood samples were obtained and all the things that they normally do, and, yada, yada, yada. And what they found is that there was a significant improvement in brain function in these patients. So what we're really seeing here, and what this really interprets, take it away from the Huntington's chorea pattern, is that there is so much out there that we're missing as a society that we normally should be consuming, and we're just not paying attention because, my mantra, sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, that's what we put into our bodies. We don't put good stuff in. And now when we start putting good stuff back in the body goes, oh my God, thank you very much. And it begins to change everything quickly. See, as long as you're breathing, your body can change. Here in our local area, Georgetown University, there's a bunch of researchers, and in addition to 25 other U.S. academic institutions that did an affiliated across-the-board study on Alzheimer's disease, it was a cooperative study. And what they're doing is they're looking at resveratrol as something that may also help in Alzheimer's disease. Isn't that interesting? I wonder why that people who drink wine and grape juice and so forth may have a less incidence of this type of problem. Now, I'm being a little facetious, but this trial was over 12 months, and it was both men and women, and ages of 50 years old and over, that had very moderate displayed dementia to things that are much more significant relative to Alzheimer's progression. And the participants initially were given 500 milligrams of resveratrol a day or a placebo. They didn't know which one they were getting. And the dosage was increased over a period of 13 weeks. And they gave it up to 1,000 milligrams twice a day. So they did crazy things like lumbar punctures, where they stick a needle in your back and pull out the spinal fluid. And then they did MRIs, and they did scans, and they did other blood tests and so forth. And they monitored the participants' progression over a period of, I think it was 10 or 12 visits. What they are looking for, the researchers are hoping to determine whether supplementation with resveratrol is helpful in delaying or altering the deterioration of the memory pattern and daily functions in Alzheimer's disease patients. It's a very, I'm not sure why they're do it in this way, because my brain says there's another way to get it done. It's a fatty acid metabolism pathway problem in many of its representations. We know that medium chain triglycerides like coconut oil will help in Alzheimer's patients. There's a lot of anecdotal clinical studies out there and representations that if you take a patient who has Alzheimer's, particularly initial stages, and you give them coconut oil at very significant levels on a daily basis, they see retardation of the progression, and in some situations have noted that the patient has actually reversed itself. So there's lots being done out there, and you really need to be aware of it, because it's all about you. Health is a do-it-yourself program, and my job is to make you aware. 888-630-9625. Give me a call. Let's go to the phones. Pat, how can I help you?
Hi, Dr. Roselle. Thank you for taking my call.
Thank you for calling, Pat.
I'm calling it bioreflex because of my history of what's happened, but currently I can't lay down without having GERD, which is a bitter bile taste in my mouth.
Sure.
And but if I could just take a moment to kind of give you just a little background of what's preceded this. But maybe you just have questions.
Well, I do. I have a lot of questions. And so let me ask you some defining things. Pat, with any kind of reflux pattern, whether they call it GERD or anything else, but it's coming up in the esophagus, it tastes like bile, it tastes like acid, it's bitter, and so forth. The mechanism of that is multifaceted. And when you actually get the regurgitation and not just the burning sensation, if you will, what's happening is the sphincter, the valve that closes the esophagus, the food tube, off as it goes into the stomach, is not holding well. And so it leaks. And so you're back flushing the stuff out of the stomach. And there's many things that will cause that to happen. There's this big muscle that cuts you in half. It's called the diaphragm. And it separates the chest where the lungs and the heart are and so forth from the stomach and the intestinal tract and all the organs of digestion. It has 3 holes in it, and these holes allow the passage of the aorta that comes off the heart and goes down, something called the vena cava, which is the big vein, and that goes down, and the esophagus, the food tube. So they all pass down through this diaphragm. Now, the diaphragm is a muscle like any other muscle, so it's susceptible to spasm and imbalance and pulling in abnormal fashion. It has nerves that go to it. The nerves come from the spinal system that's between your shoulder blades. Also, there's nerves from your neck called the phrenic nerve. They come off the second and third vertebrae area of your neck, or the second and third nerve roots, and they go down and they actually touch the diaphragm and help it move. And there's another one, there's a cranial nerve called the vagus nerve. So you have 3 neurological inputs. So you have this muscular pattern that needs enzymes, and it needs phosphatase products, and has the neurological input. So if the muscle is being not stimulated properly by the neurological system because you have a nerve that's overstretched, a nerve that's being pinched, or mechanically because the muscles around it aren't strong, pretty soon the stomach starts pushing up against the diaphragm, and the valve that closes off when you bring food into the stomach now becomes more incompetent. And you begin to push this bile up into the esophagus, and you taste it, or it burns you, or it has that type of effect. Now, when you evaluate a problem, you just don't throw medication after it to stop the acid and so forth, because in many cases that burning has nothing to do with acid. It has more to do with alkalinity. If you've ever had a garden and you put too much lye on the garden, it's going to burn just like putting too much acid on something. So you have to find out whether it's alkaline or whether it's acid, and you fix that. But more importantly, structurally, more often than not, if you fix the neurological system, if you fix the structural input, you can fix most GERD conditions. But it has to be identified properly. Unfortunately, when you throw medications at things, you begin to have other problems. You stop the absorption of calcium, you stop the absorption of protein, you stop the absorption of B12 and many other minerals. The body begins to deteriorate because of that, and you increase the risk of things like osteoporosis and muscle atrophy and of that nature. Pat, we're coming up to a break. Unfortunately, I hope I gave you a little bit of information. It's a big subject, and we could talk about it really for the rest of the day. You're listening to Dr. Tom Roselle Live. We'll be right back. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Call me, 888-630-9625. That's 888-630-WMAL. Love to talk to you. Anything you want to talk about. I've got several things we're hashing over today and some more things that are in the news. But before we get to that, I want to remind you of some things. Don't forget, thermographycenters.com, 20% off any thermographic imaging for the rest of this month. If you call and schedule and pay for it, they'll do it next month, but you got to pay for it, and tell them Dr. Tom Roselle said so. I want to remind you, and I want to encourage you, because we're really filling up pretty quickly. Ageless Health 2012, October 20th, is almost here. And you basically have less than 2 months at this point to register. The VIP section is all gone. The main section is starting to fill very rapidly. This is a seminar. This is a conference. This is a one-on-one with you and our entire staff. It is a very inexpensive day. It starts early. It goes all day long. You're going to get information about how to adapt and how to take control of your life. Remember, Health is a Do-It-Yourself program. we're going to give you so much data that you can go home the next day and have a step-by-step guide of how to change things, how to make life different, how to improve your wellness index, not only for you, but for your family. Register 2 of you, and you can get a discount. Go online, and you register there, you get another discount, because we're going to save you $5 just by registering online, because we don't have to deal with the paperwork then. But if you register 2, you get an additional discount for that. So get it done, fill it up, because pretty soon you're going to hear me saying, you know, Ageless Health 2012 was a great event. Dr. Evan Mladenoff, one of my dearest people and friends and colleagues in the entire planet. This guy's brilliant. And he was a doctor of the Kansas City Chiefs for 12 years. He's going to be our guest presenter. He's going to talk about the emotional side of healing. I talked to Evan last night. He is an amazing human being. This guy is right on. His presentations are always over the top. He's going to have videos. He's going to stimulate you like crazy. Plus, at the VIP lunch, you're going to be able to sit and talk to him. And, you know, it's just a day that I can't begin to encourage you that has to be a must in your life. We've been doing this. I think this is our 13th year. We change the information every year. And it's just one of those events that if I wasn't presenting it, I'd be there. Get online. Go to rosellecare.com, ROSELLECARE.com, and register. And don't let another day go by before you do that. Want to share something with you that I began to tell you about 2-3 weeks ago, because it's, as they say, it's ready to go and it's in the can. I'm very proud of it. I'm excited. I'm over the top excited. WIDA, Public Service Television, is doing a 90-minute documentary on my work, Ageless Health. And it started about a year ago. And we finally saw the raw cut, and we saw the trailer on it, and this thing is dynamite. It is amazing. It's going to show you what happens truly from the triad of health, structural, chemical, emotional. It cameos 6 patients with amazing results who had devastating conditions. One patient had MS and totally in remission after treatment. Another patient is an athlete who went to the best of the best in sports medicine, couldn't do anything, resolved. A child who was in tremendous pain, little boy, over the top, and the results are incredible. And 6 patients with those types of things. You have got to see this thing. It is going to be one of the most amazing productions that's going to turn your head around. And we're going to have tidbits of it at Ageless Health, by the way. So mark on your calendar, November the 29th, which will air in this area, in the tri-state area, in Maryland, D.C., and Virginia. And then it's going to happen again in January. And then it's going to go throughout the country. We are so excited because we're excited for you. This really shows you how you can turn things around, how you can turn your life around, how you can take control, how you can change virtually anything as long as you take the steps in the path that will allow that to happen for you. November 29th, WIDA, don't forget to watch. I'm telling you, this is going to be good, and please join us for Ageless Health. 888-630-9625, that's 888-630 WMAL. Love to talk to you. There was an interesting article in another journal, and it was called, well, let me tell you what it was about. It was actually the Journal of Clinical Endocrinology and Metabolism, and they were doing an article on vitamin D and calcium. What the conclusions were is simply this. People who take vitamin D and low levels of calcium have a decreased risk of dying compared to other people. Well, what are we talking about dying? Everybody's going to die, right? We're all going to check out at some point. We're talking about longevity, and we're talking about quality of life here. And the study was kind of extensive, 1,000 women and men who had a median age of 70 years old. So they gave part of them vitamin D and calcium, low levels of calcium. This was done, by the way, in Denmark. And what they found was that over a period of 3 years, that the people who were taking the vitamin D and the people who were taking the calcium didn't die, where the other ones, their risk of, checking out was what it was before they took that stuff. So people have outcomes that can be helped along the way, if you will, by doing certain things. How many get outside and get sunshine? How many of you actually eat properly? How many of you get a little bit of exercise? How many of you learn how to calm your mind? I would guess and venture to say not a whole lot of us. But I'm going to teach you how to do that. That's why we're here. That's why we do Ageless Health. That's why we're in existence. We'll be right back after the news. Don't go away. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. I am in studio. 888-630-9625. That's 888-630-WMAL. Love to talk to you. Going through several things that are out and about, but we're going to talk about other things as well, your things, and there's several of you online, and I don't want to ignore you. I want to tell you something about the Ageless Health book, Ageless Health 101, Health as a Do-It-Yourself program. Guess what? We've reduced the price on it, and because now we've got a lot of books out there, and so we get the opportunity to save you money, but both for the CD and also for the book. So how you find it, go to rosellecare.com, ROSELLECRE.com. Go to our iStore, and you'll find that the price of the book has been reduced significantly, and you know, it's all about economics. The more you get to sell, the lower the price comes down. You know, the less you sell, the price has to stay up. But you know, we're there for you. Joe, how can I help you? Thank you for calling, sir.
Hello, doctor. How are you?
I'm great, my friend. How are you?
I'm good, thank you. I suffer from gout.
Okay.
And I have tried a whole bunch of home remedies, potato juice, celery, cherries. I have tried acupuncture, and I have ended up with allopurinol and steroids when it flares up.
Have you changed your diet?
I have given up meat. I have given up red wine. I barely drink.
Do you drink coffee?
I drink coffee, yes.
Okay, get rid of the coffee. Now,
really?
Yep, I'm going to tell you why in a second. Purine metabolism it's a failure of purine metabolism of the liver, and that's the biggest problem. There's several things that will trigger it. And some people, because of things that have happened to their liver and the liver pathways being congested, have more of a problem, more predisposition. But in my experience over the years, gout is something that is very treatable. All those things that you've done are really good things, and they need to be done in combination. Now, what we do know is that the crystals, the uric acid crystals, get into the joint spaces, and they most commonly affect the big toe, but they can affect the ankles and the knees and the fingers and so forth. The big toe first, because that's where the liver acupuncture meridian starts. So what you're getting is a jamming of energy, and the joint space goes crazy, and, if you've suffered it for a long time, you know what the deal is. Now, it's like so many other types of problems, gout is an inflammatory problem, and it is really due to habits and lifestyle over a period of years and accumulating. So, what we tell our patients and what we guide them through is you have to avoid things, unfortunately, that have high sources of uric acid, just so you don't add to the problem. Any kind of organ meat, sardines, anchovies, things that are high in purine types of substance, lentils, peas, beans, mushrooms, cauliflower, spinach. All those things have to be avoided while you're getting under control. But you have to eliminate coffee, particularly, but anything that has caffeine in it, because it has an effect on the liver. The liver has to process that. You have to minimize alcohol. A little bit of wine occasionally, you can get away with, but not, it's one of those things, as we're treating it, we'll get patients off of that. Alcohol causes dehydration, and subsequently it irritates the system, and the uric acid crystals become more abundant and concentrated, so subsequently you got a problem. You must drink tons of water every day to flush the uric acid out of the body. Take your body weight, divide it in half. That's the number of ounces per day you should be consuming, minimum. And if it's hot and you're out there sweating, you need to do more than that. Cherry juice obviously is one of those old things that work, but you have to do the other things in combination with it. If you're taking niacin for any reason, you need to stop that while you're treating the gout, because it'll trigger it. There's a group of drugs called cyclosporines, and they're immune suppressive types of things. They're used in organ transplants, L-Dopa with Parkinson's patients. All of these things are known to trigger gout problems. But you have to look at the patient's individual background, and you have to take action accordingly. most physicians are going to describe anti-inflammatories, the different NSAIDs and the non-steroidal anti-inflammatories, and these things, unfortunately, they rebound and can cause the problem even to be much more severe later on.
Yeah.
And they cause the joint spaces then to degenerate, because what happens is that they compete for the different receptor sites. But there's a lot of things that are very straightforward. You got to do that with a diet, then acupuncture, then you've got to clear the liver, you've got to detox the liver, you've got to fix the intestinal tract, and then, by the way, you end up with a system that works again. But
is there a fast way to detox the liver?
Not in this situation, because you've got to start taking things off gently. If you go into a full detox pattern, you're going to get sick because the liver's not working. Just by fact that you have gout tells me that liver metabolism phase 1, phase 2 is not working the way it's supposed to with you, and you're gonna end up with a problem. But things like digestive enzymes, like the bromelains, the proteolytic enzymes that the liver is supposed to produce, those things will help. And if you take that decreases some of the inflammatory responses in the body. Pineapple, by the way, also can make a difference. Just if you're not taking straight bromelain, go get some pineapple. Eat some fresh pineapple. That will help break it down. There's tremendous amount of homeopathics that will affect the immediacy of it, but the fact that you've played with this for so long, you really need to be handheld through it properly, and you can get to the other point, you can get to the end where you're not going to suffer with it anymore. We'd love to help you. Let us know, Joe. Anytime, give us a call.
Absolutely. Thank you for your advice, and I will call your office.
You're welcome. Fred, how can we help you, sir?
You mentioned calcium and vitamin D, but you didn't say what levels you would recommend people take and maintain. And what do you think of allopurinol for the
for gout? No, we just talked about it. I don't like the drug at all. Allopurinol, like so many other drugs, has a side. It's not. See, the thing of it is, it's not fixing anything. It's just decreasing the formation of the uric acid, but the underlying why is that liver function, liver metabolism, purine metabolism is not being affected at all. So you have to treat the cause. That's what we do. We don't recommend symptomological treatment of anything. What we're all about and what we try to get you to understand is that no matter where you are in your life at this moment in time is a direct result of the choices that you've made. Disease, dysfunction, pathology is the progression timeline as a result of the choices that we make. So I don't like medications. They're the last things that you would use to get you out of a crisis. Now, if you're bleeding in the street, and you need something to stop the bleeding, and until they get you sewed up and handle that, that's a different story. If you're in the middle of a heart attack, there's things that you need to have to get it done. But we're talking about functional medicine, things that are a result of a day-to-day lifestyle thing, and the body will reverse itself, but you have to be willing to step into it. Some people don't want to. Some people say, hey, just, give me an aspirin to get rid of my headache. Well, I want to know what the headache's there for and, handle it. So let's get to your calcium and vitamin D question. It depends on where the levels are. Vitamin D is measured in the laboratories. The guidelines in laboratory is from 30 to 100 units. And medically they tell you, well, if you're above 30, then you're okay. Well, that couldn't be further from the truth. Anything under 50 is considered insufficient. Anything under 32 is highly deficient. And so you increase your risk of all kinds of things when vitamin D levels are low, not only just bone density, but immune function problems and so forth. What your target range is for most of us is about 70 to 75. If you're in that level, even 80 and 85, you're in a good place, and your body's immune system is working better, your body's stronger, and good things happen. So why?
When you say 30 to 100, you're talking about milligrams per liter?
Yes.
Okay.
And whether you're going to Quest Laboratories or whether you're going to any of the other labs, some of them will go to 32 to 100, but most of them now are 30 to 100. It just doesn't work. So what you have to do is you take. If it depends on where it is. If I have a patient who's in there, at 40, 45, I may give them 2,000, 4,000. Depends on intestinal absorption, because vitamin D is absorbed in the upper portion of the small intestine.
2,000 to 4,000 what? Milligrams?
International units.
IUs.
Okay. And then you'll find it. You'll go and you'll find Carlson Laboratories are pretty good, but don't. you got to know what your vitamin D status is. Okay, just don't take it because you want to take it. Find out what your vitamin D status is, even though all of us can probably use some vitamin D. But if you're going to do something therapeutically, you need to know. And it's vitamin D3. It's not vitamin D2. And then you monitor it. If you start on vitamin D, 100 days out, you repeat the blood work, and you find out what the status is. Some of us can maintain 2,000 to 4,000 units a day. I take, because I live in a cave, meaning I go to work when the sun's down. I come home most nights when the sun. I take anywhere from 8,000 to 10,000 units a day. Some days when I'm out in the sun, I'll take 4,000 or 2,000. If you use soap, you take a shower and you use soap on your body, you block the absorption of vitamin D. If you wear makeup, if you have anything on your skin, sunblocks, or anything, you block the absorption of vitamin D. So it depends on many different things and how we prescribe. Now, as a man, your calcium level should be low. Your intake of calcium from all sources doesn't need to be that high. Maximum of about 400 to 500 milligrams a day. Maximum. And you don't want to take a carbonate form, because a carbonate form is very difficult to absorb. You want to take something like a calcium chelate or a calcium lactate, MCHC, microcrystalline hypoxyapatite. Those are different forms of calciums, and it's best served when you're taking many different types of substances from your foods. Remember that you have more usable calcium in a cup of cooked vegetables or a cup of cooked spinach particularly than you do in a glass of milk. You can't absorb it from milk. You can't absorb it from cheeses at high levels because of the pasteurization process. What's happened is it's taken the calcium and converted it from a covalent bond, which can cross the blood tissue membrane, to something that's called an ionic bond that kind of sits there, and your body's got to metabolize it out. Otherwise, it serves as a source of plaquing. So there's a lot of considerations. Low dosage is the best. Use laboratory guidelines to monitor what you're doing, because in these types of situations, Fred, a lot is not better necessarily.
Okay, you said 4 to 5 milligrams per day?
No, 400 to 500 milligrams per day from all sources for a man.
Okay.
Okay?
And what should the blood level of calcium be?
For you, probably in the neighborhood of 8. The laboratory range is going to go up to 10. And when you see it, look at 8.5 to 9 would be the highest. You start sneaking up into the upper levels, you're going to start thinking about parathyroid problems or absorption problems or just not transport. Fred, I got to take a break. We're coming up to a place where we've got to acknowledge some of our supporters, our advertisers, people who make this show possible. We're talking about a lot of different things today. We talked about gout, and we talked about things in the news, and we're talking about calcium metabolism. What's your question? 888-630-9625. And you can get a hold of me offline or off the air at rosellecare.com, and I will always get back to you. Just send me a note and say, hey, listen, this is what I need to know about, and I will call you. Don't go away. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live, 888-630 WMAL. That's how you find us every Sunday at 12 noon. We're here for your education. We're trying to give you as much data as we possibly can to promote you, to trigger you, to entice you to go out and learn more for yourself. That's why I'm still in practice. That's why we'll continue until all of you get it right. Anytime we can help you, you can give us a call at 703-698-7117 or go online to rosellecare.com. I also want to tell you that all the programs that we do and all the topics that we cover, you can go to Roselle Radio right now and download whatever you want to do. They're there. You can re-listen to any of these programs. You can go to WMAL and go to my personal page there, and you can find the last 4 programs. So you have multiple ways of doing it. Go into my website at rosellecare.com, and you can check out some of the old radio, and it's going to link. It goes from here to there and back and forth and so forth. But take a tour. Go check it out and see what it is that we're doing and why we're here to help you as much as we possibly can. Want to acknowledge those of you who came to Dr. Poe's presentation last week. Now you know why you have to have a reservation, because we were packed. People were in the hallway. And, it's just one of those things. There were so many of you, and we want to be useful to you. We want to give you as much data as we possibly can. Do a lot of reading. Question me. Question everybody. And see how it applies to you. Remember, your benefits of your health start with your first step in taking control of your life. Don't wait for somebody to do it for you. Don't buy into the Fifth Avenue marketing that tells you got to take this drug for the rest of your life. You know, the same goes for supplementation. How many supplements do you want to take forever? You want to take a basis? Learn what foods are about. Make sure they're organic. Make sure they're clean. Make sure they're vibrant, that you're eating enough. You're getting enough proteins from all sources. And get exercise and learn how to control your brain and do things that live within the triad of health that we talk about, the structural, chemical, emotional pieces that cause anything. See, there's nothing that goes on in your life that isn't from those three pieces. Dr. Poe, last week when he was on the program, we talked about something called the vanishing male. And that's basically what that is that men are losing their capacity to, potentiate their species because testosterone levels are going down around their tubes and estrogen levels are going way, way up. I'm going to do a presentation on that at some point, probably this year or maybe in the first of the year, and we're going to invite all of you, and it's going to affect both men and women. So hopefully we'll be able to give you some data to make you really understand why these things come about and what you can do to protect yourself, because it's important. It's critical that you protect yourself and that you get the data, you get the information, and you apply it. You know, there was an article that was just written on quercetin, a broad spectrum protection. Well, quercetin is one of those great things. It works really well, and we use it with our patients who have environmental toxic reactions and allergen reactions and that have exposures to, radiation, who have damage to the arterial system, because it can readily correct a lot of things. And it's found in a broad range of foods, from, grape skins to onions to green teas, tomatoes and so forth. But it's not a cure-all. It's not one of these things that you go to the store and you take it and all of a sudden all your troubles go away. The underlying condition is life. The underlying situation is how we treat our life, what our exposures are throughout our life, our timelines. You have to take responsibility. You have to be the master of your ship. You're the one that's going to be responsible, not your doctor, not me, not the advertising agencies, but you. You have to get the data, apply it properly, understand that your body will begin to heal, and change your attitude. See, so many of us are suffering from hardening of the attitude that we get fixated. We get focused in one particular area. Well, my job is to change that for you. Your job is to take the information and run with it. So whether you're 3 or you're 103, it's really all about you. That's why I'm here, and that's why I'll continue to be here. If you need to contact me, rosellecare.com. This is Dr. Tom Roselle. See you next week. Bye. Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible: freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com. Did you know that maintaining a total state of wellness is a choice? That you have total and absolute control over anything that happens to your health and wellness? This is Dr. Tom Roselle, author of Ageless Health 101, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. A state of total wellness is your choice. You have the capacity to change your health and level of well-being. Take control of your health. Are you looking for great tennis instruction in a dynamic, challenging, and fun environment? Hi, this is Dr. Tom Roselle, inviting you to visit rjtennis.com to learn about the most popular adult tennis program in the metro area. RJ Tennis programs are packed full of energy and non-stop tennis. With exhilarating drills and games, RJ Tennis will energize your game, fitness, and life. So call a friend and sign up today at rjtennis.com. That's rjtennis.com.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.